Quality control in respiratory therapy on the ABG machine. What a nerdy topic. But you got to know for the NBRC exam and to practice respiratory therapy. So as the Japanese would say, "学ばなければなりません." Hey everybody, welcome to Quality Control Part 2. The first part, Part A, if you haven't watched that yet, catch that video. We talk about the differences between quality assurance, quality improvement, and quality control. But this part of the video is going to focus on quality control. Just to refresh ourselves, remember that quality control is really about the data that we might receive from analyzers and machines, analyzers in the hospital that tell us data or specific numbers. That's important to us because we need to make sure the numbers that we get from these machines and these analyzers are correct. Why? Because we're going to make changes to the patient care based upon that. So we always want to make sure that these machines are working correctly and that they're reporting accurately. Quality control is about checking these machines and these analyzers from time to time to make sure that they are working accurately. Now this applies to a broad range of machines and analyzers, including things at bedside like a glucose or a blood sugar monitor. We must do quality control on those. We don't typically have to do those in respiratory therapy, though I have seen hospitals where they have the respiratory therapist do that. But nursing units are going to run controls on there just to make sure that this thing is actually working correctly. But it's also true if you walked into your laboratory, the clinical lab, you see all kinds of analyzers analyzing electrolytes and all kinds of things there. Every single machine there, all machines there have to go through quality control. Remember also that quality control means that we're going to take some kind of fake substance, most of the time a fake blood, and we're going to introduce it to the machine. The fake blood has been produced by a manufacturer, and the manufacturer has preset what those values should be. Now, I like to look at a blood gas analyzer, for instance. That means for an ABG machine, we're going to have quality control material, and we're going to introduce it to the machine, and that fake blood, according to the manufacturer, will have a set pH range that it's supposed to come in at, and a set CO2 and a set PO2 value. If the machine does not come in at that range, then the machine is considered out of control, and you would not want to do patient testing. But if it is in the range, then it's okay, and you have proven that the machine is good for patient testing, reporting, and most of all, to act upon the patient. So in other words, treat them in whatever way you think is necessary. So that's what quality control is. But now we want to take a look closer at an ABG machine and how we introduce quality material, analyze the results. We also plot the data, and we can look at that and tell some things from that data. So let's take a closer look at that. Hey friends, if you're liking this video and getting something out of the content on Respiratory Sensei, could you just do me a favor and press the subscribe button and the like button? Well, you know how it works. It just helps the YouTube algorithm and helps me to reach more people. Thanks for watching. All right, now this isn't true for every single machine in the hospital, every analyzer. It is for a lot of them, but certainly it is true for an ABG machine, an arterial blood gas analyzer, that the federal regulations typically require that be proven to be accurate at least about once a shift. Now, it is kind of sketchy here and there, so it's usually done about every 8 hours. Technically, you could do it every 12 hours, so it can be done just twice a day. A lot of labs will go ahead and do it 3 times a day because of this. If you went more than 12 hours and the respiratory therapists were busy and they didn't do it, they can't analyze the blood. And you're not supposed to use blood analysis and reporting until you have done that. And so a lot of hospitals will default to every 8 hours, even though you could do it every 12 hours. But 8 hours, 12 hours, about once a shift. All right, and so what we're going to do is we're certainly going to introduce the quality control material. We're going to get some values back, and we're going to prove that it can control. But we're also going to do something else, and it's usually done by computer. Very often the machine or the blood gas machine will do this itself. It'll record in its history on a certain day, a certain shift with the pH value of this control. Here's what the value was, and that it was in control. We can then take that information and we can plot it on a graph. And if we look at the points on that graph, we can tell some things, and we need to watch that graph very carefully to see what it looks like. Now, these graphs are commonly called control charts. That's kind of a generic name, but they may also be called Levy-Jennings chart, and here's one right here. If you look at this, you'll see that what we have is that we have every shift a point shows up where we're analyzing. Now, I could put all kinds of labels on this graph. This might be for pH or CO2 or whatever. It doesn't really matter. What we're looking at is the points on the graph. What I do want to point at is some of the features on the graph. The first thing you'll notice is that as you look at the top part of the graph, it's got a top line and a lower line. This is called the upper and control limits, the upper and lower level control limits, I should say. Now, with those upper and lower control limits, the points should be within those things. It shouldn't go above or below. If it does, we're going to consider that machine out of control. You'll also notice here that there's a line in the very middle. That's the mean. The mean is just the middle average. It's not that important, but that's the upper and lower control limits. Now, I also want to caveat here and show you something that a lot of respiratory therapists don't know, but it is kind of important to know. It is the upper and control level limits. Those are calculations based upon standard deviation. No, don't worry, you're not going to have to calculate standard deviation on the NBRC exam. But what we allow is we allow for things to go up 2 standard deviations and down 2 standard deviations. That means the range that we'll allow is a total of 4 standard deviations, 2 up and 2 down, below and above the mean. So 2 standard deviations is important. That means that our machine is accurate if it's within 2 standard deviations. That's just a statistical model that you need to understand. But here's the important part that a lot of therapists don't understand. If I were to ask you, what is the acceptable range for CO2, you would tell me 35 to 45. That's been burned into your brains for years, right? But if I change the question just a little bit, and this is a little bit tricky, what if I said, what's normal CO2? The answer isn't 35 to 45. The answer is 40. And right now, I can't see you guys, but if you're not breathing hard, and I could assume that you're not COPD, if I said, what's your CO2 value? It's 40. However, if I were to check a blood gas on you, I might not get exactly 40. I might get 34 on one of you and 42 on another. Does that mean you're 33 or 34 or 42? No, you're actually 40. So why am I getting a different number? And it's because the blood gas machine isn't exact. It's going to get it off a little bit. In other words, you are 40. That's normal CO2, but we're willing to accept a certain amount of air. How much? 35 to 45. Well, 35 is 2 standard deviations below the mean, and 45 is 2 standard deviations above the mean. But that's not what you are. It's just the amount of air that we're willing to accept. And that's why we have an upper and lower control limit. All right, now let's take a look at some graphs and see what we can see from them. So let's look back at this graph here. What you'll see is that points are around the mean. They're kind of all over the place here. But they're fairly tight. They're fairly close to the mean. Most importantly, you'll want to see that the points are all between the upper and lower control limits. They haven't exceeded the top line or the bottom line. Because of that, we can say that this machine is in control and we can use it for patient testing. But now take a look at this other one here. This one looks very similar, except the points seem to be scattered about a little bit more, and they're not as fine-tuned or fine close to the mean. Well, in that case, just look closely. They're still all between the upper and lower control limits. We really don't care where they are as long as they're in between the top and the bottom line. We would still call that machine to be in control. What we would say is that it's got a little bit looser control than the first one. The first one had a little bit tighter control because the points were very close to the mean. That just means that machine is operating with fairly high amounts of precision. And one might also say accuracy. But both, including this one where the points are spread about, both are considered in control. All right, now take a look at this one. As you can see here, the points seem to be going in a certain direction. Now, notice that the points are still within the upper and lower control limits, and so we still would call this machine in control, and we could use it for patient testing. But notice how the points are on one side of the mean, but they are gradually moving toward the other side of the mean. They may be going from down to up or up to down, whatever the case may be. What we notice here is that the points appear to be trending. Now, you can still use this machine, but we want to watch it more closely. Think about this. These points are happening about every shift, and this means if you keep going here, this trend keeps going, in the next 2 or 3 shifts, we might start getting points that are above or below a control limit. And then the machine would be out of control. In other words, as you look at a trend, you can kind of say, boy, if this keeps up, this machine is going to go down. We're not going to be able to use it here in the next 2 or 3 shifts. And then I may have to do some calibration, and then I may have to do some repair. So that's called a trend, and you just kind of need to label it. But they could show you this graph, of course, on the examination. That's possible, but they could also just use the words. Now listen to the words. I could describe this as points are generally below the mean. They start off below the mean, but they gradually start increasing to above the mean. Notice the word gradual. Gradual means that they are trending. Now, take that and take a look at this other one here. This is interesting because this one doesn't show a gradual. The description here would be that points may be above or below the mean, whatever the case. They are above or below the mean, and suddenly they show up above the other or below the mean. They show up at the opposite side of the mean. This is called a shift. And shifts are interesting as well. Shifts are kind of less dangerous than trends because things shift all the time in a blood gas lab, and the main reason why you would have a shift is because, well, it's because the weather changed outside. Probably the barometric changed, there's a storm moving in. So we look at shifts and think, oh, well, whatever, as long as they're still inside the control limits, then this blood gas machine is still in control. So you don't have to stop patient testing with either a trend or a shift, but you do need to notice and recognize that something happened. Why did it shift? Was there a barometric pressure? You may have to describe that. Now, you don't have to describe that on the test. Mostly we just probably anticipate that you just have to say, you've noticed a shift. All right, and so that's a trend and a shift. Now, take a look at this one here. This is interesting. This is called a random outlier. Notice here that we have one point that is outside the upper or lower control limit. In this case, it's above it. As soon as that point happens, that would be considered out of control, except there's a caveat here. A lot of therapists and people who run ABG labs don't know this. In truth, here's a dirty little secret. If you go in on your shift and you run and the point is out of the control limits, technically you can ignore it. You can ignore one point. And then, though, you have to see on the next shift, that point better be back in. If it is back in control, it just happened on its own without you doing anything, then that point that was out of control is called a random outlier, and you can totally ignore it in that case. And so that's called a random outlier. Now, most people in labs, that makes them nervous. So if a point is out of control, they'll just do a calibration, a 1-point, a 2-point, or even do some repair if they need to, and then do the control right away again so they can get that back in. They're just settling their nerves. But technically, legally, you're allowed to ignore just 1 point that looks out of control because that's a random outlier, as long as the next point and the points after that come right back in. Now, finally, take a look at this final graph here. Can you see that the points started gradually going up? That's definitely a trend, moved up, and they went out. Several points are out of the control limits. This machine is out of control, and you should not use it for patient testing. Not only should you not use it for patient testing, but you should flag this machine, put a sign on it, so that everybody that comes up to it says, no, this machine is down. I shouldn't use it for patient testing. Now, in most machines these days, it's automatic. It's kind of probably doing the controls without it even being there. We all have mixed feelings about that because the machine itself is tracking itself. But if it can't correct itself by doing a 1 or 2 point calibration when it finds something that's out of control, then it'll flag itself is down. The screen will say, do not use. So you need to do some calibrations. The machine may even try to do calibrations on its own. So if it has that sign, it's probably tried that, and now you probably have to call the manufacturer or do some kind of repair or some maintenance on the machine. And that's what you need to know for that. Those are the control limits for upper and lower control limits that you need to be aware of. This is how standard deviation works. These are called Levy-Jennings charts when you see them. And so that's what you need to know there.